My name is Blythe Lee. I'm a 10-year breast cancer survivor. Thank you for listening and hearing all of us, and I am in complete support of this bill. Thank you.
Fiskin Lee, and I'm disabled with end-stage heart failure, and I'm also Blythe Lee's daughter, Oakland, and in very strong support. Thank you.
Good afternoon. My name is Shelly Norris Alvarez, and I'm a mental health professional, and I strongly support this bill.
Hi, I'm Jesus Alvarez, and I support SB 128 in name of my father-in-law who passed sufferingly with emphysema, and at his end of life, the only picture I have in my mind is him groping for air. Please pass this bill.
Nancy Jacobson, San Francisco, California, two-time oral cancer survivor, and with the half a tongue I have left, I strongly support this bill.
Dina Smith of Sonoma, and I respectfully urge you all to support this bill.
David Martin, physician and professor. Having seen thousands suffer needlessly, I strongly support this bill.
Hi, I'm Charmaine Manansala. I'm a person with disabilities. I've had MS for 14 years. I urge you to vote yes on this bill.
Hi, I'm J.C. Rowe of Richmond, California, and I support SB.
My name's Christina Goodwin, and I support SB 128. Thank you.
My name is Julie Crozier. I am of Senator Dodd's district. I'm here in support of my father who died from congestive heart failure. I watched him drown in his own liquids for 2 days before he passed. And then 2 weeks ago, I watched a friend of mine drown because her blood pushed through. So I urge you passionately to pass this bill. Thank you.
My name is Sanmukh Bhakta, who lost a son 6.5 years old in '94. I strongly support this bill. I also lost my cousin last Thursday, and today is her funeral. But I thought I should be here to support this bill. Please support this bill. Thank you.
I'm Constance Rubiano, San Francisco, and I thank you for sponsoring the bill. Thank you for bringing it up. It's time.
Alan Beek from Newport Beach, Orange County. Orange County is a great place to retire. We have lots of senior citizens there. They can't all make it to Sacramento for testify, but they can all vote.
Aline Hammer, Santa Cruz County resident. I stand in support of SB 128. I believe that this is the civil rights issue of our generation. I beg you, do not let us down.
I'm Susie Cohen. I'm in your district, Senator Pan. Hi, Holly. And I really urge you to vote yes on this very important bill. Thank you, Senators Wolk and Monty.
I'm Bill Piper. I too am in Senator Pan's district. And in memory of my now deceased wife and mother-in-law, I urge you to support this bill. They could have benefited from it.
Brandon Bland from Richmond, California, and I support SB 128.
Claire Smith, I'm a resident of Sacramento in your district, Senator Pan, and I'm here to express my support of this bill on behalf of my mother, Noreen Mulholland Smith, who died March 31st, 2006, an agonizing death by pancreatic cancer. Thank you.
Karen Phillips, representing my brother with a brain tumor level 4. I support this bill.
Margaret Henderson, Ukiah, California, representing We Are Gatekeepers. I'm a threshold singer. Thank you for passing this bill.
Hi, my name is Christy Peters from Berkeley, California, and I'd like to ask you to support this bill. I don't want anyone to have the memories that I have of my father begging me to take his life and suffered unbearable pain despite the morphine, all the advanced drugs. He suffered writhing in pain.
Thank you.
Thanks.
Hello, my name is Molly Hayes, and I'm here on behalf of my father, who was the driving force behind the Right to Die legislation in California, and when he begged me to end his life, I could not. I'm also here on behalf of Compassion and Choices. Thank you very much for this bill. I passionately support it.
Hi, my name is Pete Sklar from El Cerrito, and I urge you to pass or to support this bill. Thank you.
David Burnbeck, Walnut Creek, hospice volunteer, retired social worker, strongly support SB. Thank you for introducing it.
I'm Dr. Robert Maher. I've been a pediatrician in Senator Pan's district for 35 years, and I support this bill.
Hi, my name is Crystal Smith. I work with Compassion and Choices. I strongly urge you to support this bill and follow suit from Canada, where my parents live, and this is legal throughout the country. Thank you.
My name is Tom Pierce. I'm from Marin County, and I strongly urge you to support this bill. Thank you.
Thank you. Anyone else in support of the bill? Opposition to the bill? Name and position and who you represent.
Good afternoon. Thank you very much. My name is Ruthie Jonas Goldkorn. I am representing Californians for Disability Rights, whose members would support a well-crafted bill with no regard to socioeconomic status, institutionalization, health insurance status, with and without those who have given over durable power of attorney for medical care, conservatorship, or guardianship. And I'm sorry to say, and CDR says, this bill is not it. Thank you very much.
Janus Norman on behalf of the California Medical Association. Our concerns are listed in analysis, and you heard from our members. Thank you.
Mr. Chairman and members, Nathan Mansky representing the Alliance of Catholic Healthcare in opposition to the bill. Thank you.
Barbara Glazer on behalf of the California Hospital Association. We have submitted some language to the authors for their consideration, and we appreciate them giving it consideration.
Mr. Chairman and members, Henry Contreras with the California Foundation for Independent Living Centers. We are in opposition to the bill.
Good afternoon. My name is Mike Hodes. My wife was involuntarily euthanized in a San Francisco hospital, and for all the collateral damage this bill will cause, I oppose this bill.
My name is Brian Brackney. I've worked 30 years for the rights of people with psychiatric disabilities. I am concerned that they are vulnerable under this bill. I strongly oppose this bill and bill.
Good afternoon. I am Rebecca Pearson. I am an Iraq, Afghanistan veteran. I am a clinical educator, a certified stroke and palliative care nurse, and a clinical educator working with Right to Life of Central California as the Director of Education and Public Relations, and I adamantly oppose this bill.
I'm Mary Lee Sondergaard. I am in Dr. Pan's district, and I oppose this bill with everything that is in me.
Hi, my name is Julia Reif, and I'm the State Prayer Coordinator for California, Aglow International, and I oppose this bill.
Hello, my name is Lynna Fisher. I'm a chapter leader for Concerned Women for America, and I'm very concerned about abuses that this bill holds. That's my main concern, and I'm opposed to it. Thank you.
My name is Lori Hyrup. I'm in Senator Pan's district. I'm 59 years old and was given a terminal diagnosis at least 4 times throughout my lifetime. Had I opted for this, I wouldn't be alive today to have 2 children, 4 grandbabies. I strongly oppose this law or this piece of legislation, and I watched my father pass away with terminal illness 8 years after he was diagnosed that he would only live for 6 months. And you know what? He left it to God rather than a pill. I strongly, strongly oppose this piece of legislation.
Patricia Thompson, Concerned Women for America, California State Director. We strongly oppose this. Also personally as a cancer victor, having gone through over 5 years of chemotherapy myself, now 18 years cancer-free. Praise God for what I'm able to do now.
My name is Patricia Del Marmo. I'm the Northern California Area Director for Concerned Women for America. And I appreciate your kindness in listening to so many of us. But I also want to state that I so oppose this law. Thank you.
I'm Georgia Hyrup. I'm a devout Christian, and I would never want to interfere in God's plan.
I'm Brian Johnston. I'm former Commissioner on Aging for the state of California and formerly on the Board of Examiners of Nursing Homes for the state of California. I'm the National Legal Center for the Medically Dependent and Disabled, speaking on behalf of the National Right to Life Committee today and urge you to oppose this bill.
I'm Linda Walter, and I'm in the District of Lois Wolk. I'm a registered nurse, and I strongly oppose this bill. Thank you.
My name is Wynette Sills, and I ask each of you, if someone was about to jump in front of a train, jump off a bridge, put a noose around their neck or a gun to their head, we would all want to come along beside them and help them to choose life and to comfort them. This is assisted suicide is just a more sanitized version of those same versions I described. Suicide should not be state supported. I urge a no vote on this bill.
My name is Beth Tadji. I'm an RN, and I'm supporting the California Nurses for Ethical Standards. And then we oppose this bill. Also, Father Lee had to leave. He's in Dr. Pan's district, and he is opposing this law also.
Thank you.
Hi, I'm Catherine Contreras. I'm a constituent of Senator Ed Hernandez. I strongly oppose this bill, and many of us, we do vote, and we are aware of what is happening. Senator.
Thank you.
My name is Kathy Hamlin. I'm with the Patients' Rights Council. But as a longtime California resident, in fact, born and raised in the state, I strongly oppose this bill.
Thank you.
My name is Reverend Olga Herman, and I'm a constituent here in Sacramento, Dr. Pan's district. And we've heard all these same safeguards with the abortion thing, and it's this 57 million children later. What's going to happen now? Thank you. I strongly oppose.
My name is Kathleen Ballard. I'm 61 years old. I'm in, I believe, this district. I live in North Highlands. I tried to commit suicide twice last year, and I am so glad that I did not do that. I am a devout, sold-out Christian, and I totally oppose this bill.
Greg DeGere with the ARC and United Cerebral Palsy, a coalition of people with intellectual disabilities and all developmental disabilities and their families, friends, and service providers, and we oppose the bill.
Danielle Cullum with Capital Resource Institute, and we oppose this bill, and personally I reside in Senator Pan's district. Thank you.
Rosemary Mullane for life on behalf of my 99-year-old mother who taught me to embrace life no matter what it throws you.
Hi, I'm Susan Henry. I'm a social worker with hospice experience. I've worked in Yolo County, Solano County, Sacramento County, and Placer County. I strongly oppose this bill. It will be endangering the life of too many people. Thank you.
Justin Harford, Disability Community Organizer of Freed Center for Independent Living in Grass Valley, California, resident of Senator Nielsen's district. Myself and the organization that I represent both oppose this bill.
Janelle Trevathan from Senator Nielsen's district, and I oppose this bill.
Adriana Castillo from Senator Pan's district. I oppose this bill. I am Adriana Castillo del distrito del Senador Pan y me opongo a este bill. I went through the death of my mother along with my 7 siblings, and her suffering brought us all together. I do believe that suffering has a meaning.
Cameron Snow in Citrus Heights in Senator Nielsen's district. On behalf of myself and my wife who just suffers chronic pain from a debilitating injury, and on behalf of anyone else who's had to fight the insurance companies because healthcare is too expensive, I oppose this bill.
Good afternoon. My name is John Calvin Long. I reside in Senator Pan's district. I'm here representing the California Pro-Life Council, an active organization with nearly 150,000 voting members here in California, and we strongly oppose this bill. Thank you.
Hi, my name is Lisa Da Silva, and I beg you to oppose this bill.
My name is Ezra Vier, and I strongly oppose this bill.
Steve Patton, resident of Sacramento, Senator Pan's district, and also representing Bishop Jaime Soto in the Roman Catholic Diocese of Sacramento, asking your opposition to this bill. Thank you.
Lily Jackson from American Canyon. I'm a retired RN faculty, CCSF, and I strongly oppose this bill. Thank you.
Mary Sari in Senator Pam's district. I'm very much opposed to this bill as a cancer survivor of 28 years. Thank you.
Sandra Palacios with the California Catholic Conference in strong opposition to SB 128. We'd like to submit a letter of policy reflections for your consideration.
Michael Toe with Providence Health and Services in opposition to the bill.
Jonathan Keller, Executive Director for California Family Council, and just voicing our opposition to the bill. Thank you.
Alban Romberg in opposition. Just to remind you, you're not gods. God is watching and God will judge you.
Seeing no other support or opposition, I'd like to ask the author and joint author if they'd like to close.
We would, in fact, Mr. Chair, and we will be extremely brief. We think that the arguments have been clearly presented on all sides. We want to thank the chair and the committee for a respectful hearing and for conducting the hearing in such a positive way. We want to thank our staffs, and it's time. We ask for your aye vote.
Thank you. I also just want to thank the chair and members for your patience, and everyone who testified today for their the respect they've shown for differing views. I would just close by urging an aye vote for SB 128 and recognizing that at the core of SB 128 is the primacy of the doctor-patient relationship and the respect for autonomy and the fundamental human right for somebody with a terminal diagnosis, a death sentence, to choose a compassionate transition. Thank you.
Thank you. Seeing no other comments, the close has been made. Is there a motion?
So moved.
So moved by Senator Mitchell. I understand that we have amendments that will be taken in judiciary. The bill is in mock-up form as we see it. We'll be voting on the bill. It'll be due pass to Judiciary Committee. Call the members, please.
Hernandez?
Aye.
Hernandez, aye. Nguyen?
No.
Nguyen, no. Hall?
Aye.
Hall, aye. Mitchell? Aye. Mitchell, aye. Monning?
Aye.
Monning, aye. Nielsen? Nielsen, no. Pan? Roth? Wolk?
Aye.
Wolk, aye.
That currently has 5. It has enough to get out. We're going to put the bill on call. We have some absent members. We do have to be in session. We will recess. For those of you in the audience who need to be up for the next 2 bills, I would encourage all of my colleagues to come back and not go home after session.
Yes, sir.
We still have 2 bills left. I'm looking at Senator Hall.
We'll be here. We're in recess?
Yes, sir. I'll be here.
We are in recess. For Senate Health, we have 3 bills left. We're going to move on to item number 2, SB 118, Liu, School-Based Health and Education Partnership Program. Senator Liu, welcome.
It's item number 3.
We have a quorum.
You want me to present? Good afternoon. Not evening. Is it evening? Yes. Only take me 3 minutes.
Please proceed.
Thank you. I'm pleased to accept the proposed amendments from committee as stated in the analysis on page 6, and I thank the committee for providing recommendations that improve the clarity of the bill. This bill, SB 111, is with regards to school-based health and education partnership programs. These are locally designed to meet specific needs of the student population, and centers serve students directly or through referral to an appropriate community provider. The Public School Health Center Support Program has existed in state statute for 8 years, but it has never been funded. Our centers have relied on federal funds and community support to provide a range of services such as routine physical health, oral health, and mental health services. With reductions for funding and other critical safety net programs in recent years, school-based health centers are more important than ever. So SB 118 does 4 things. It updates and expands the existing school-based health centers grant program to include a broader approach of community schools. It modifies sustainability grants to reflect the goals of leveraging existing funding streams. It adds a, quote, population health grant for the purposes of targeting specific health and education programs, such as those related to obesity, asthma, substance abuse, and mental health. And it updates terminology, including references to the Affordable Care Act and local control funding formula. School-based health centers can be an effective anchor for a broader community schools strategy. The community school strategy is a nationally recognized approach for organizing the resources of the community around student success. It is both a place and a set of partnerships among the school and other community resources. It's an integrated focus on academics, health, and social services, youth, and community engagement, and leads to improved students' learning, stronger families, and healthier communities. And with that, I ask for your aye vote, and I have a couple of folks in support of the bill.
Thank you. It appears we have support on both sides. If we could make it brief, appreciate it. Name and position.
Sure. My name is Lisa Eisenberg. I'm the Senior Policy Analyst at the California School-Based Health Alliance. I won't go into school-based health centers. You are all familiar with school-based health centers. I think that these are simple changes to a grant program that we are looking for funding through the state funding process, and I urge your aye vote. Thank you.
Hi, my name is Barbara Cronick. Good afternoon, and thank you for the opportunity to testify in support of SB 118. And it appears that I'm just going to let you know that I support it.
Thank you very much. Is there any opposition to the measure? Comments, questions from any of the members? We have a motion. Moved by Senator Mitchell. Seeing no other comment, would you like to close, Senator?
I ask for your support in the bill.
This is item number 3, SB 118, Lieu, do pass as amended to appropriations. Chair is recommending an aye vote. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen.
Aye.
Nguyen, aye. Hall.
Absolutely.
Hall, aye. Mitchell.
Aye.
Mitchell, aye. Monning.
Aye.
Monning, aye. Nielsen. Pan.
Aye.
Pan, aye. Roth.
Aye.
Roth, aye. Wolk.
Currently has 7, enough to get out. We're going to put that bill on call. We still have some absent members. We're going to move on to the last 2 items. Item number.
Thank you, members.
Thank you. Number 2 and number 4.
Mr. Chairman, please present the bill.
Thank you very much. I'm going to start off with SB 33. Members, currently the Department of Healthcare Services collects for the estates of deceased Medi-Cal beneficiaries for services they receive after they turn the age of 55. This is called estate recovery, and it is a deterrent to enrolling individuals in Medi-Cal. It is unfair to low-income individuals who need Medi-Cal for basic healthcare services. This bill would limit Medi-Cal estate recovery to only what is required by federal law. This bill also makes it easier for individuals to find out what their Medi-Cal has been spent on their behalf, and it is similar to a bill that I offered last year with bipartisan support. With that, I respectfully ask for your aye vote, Mr. Chair and members.
Thank you, Thank you, Senator Hernandez. Any comments or questions from members? Can we have witnesses, please?
Chair, members, Linda Way with Western Center on Law and Poverty, proud co-sponsors of this important measure. Now that people are required to have health insurance, this is a critical equity issue, as only the poorest Californians, those on Medi-Cal, are subject to a state recovery. Higher income individuals, such as those on Covered California with subsidies, are not subject to a state recovery. We've heard that this is a major enrollment barrier for individuals enrolling in Medi-Cal, that they would rather forego having insurance than being subject to possibly losing their family home.
Greg Deshier with the Argon United Cerebral Palsy California Collaboration. People with developmental disabilities rely very heavily on Medi-Cal. Adults with developmental disabilities overwhelmingly live in poverty. This would allow them to pass on to their descendants any modest savings they may be able to make or anything they've inherited from their parents, and we support the bill.
Pat McGinnis with California Advocates for Nursing Home Reform and one of the sponsors of the bill. We have been working with the Medi-Cal recovery issues for the last, since 1993. California has one of the most aggressive recovery programs in the country, and all I can say is, number one, it destabilizes low-income communities. And at a time when we should be working to support those communities, the passage of SB 33 simply makes good public policy. I urge your support of this bill.
Beth Capel on behalf of Health Access California and AFS, may be pleased to be here in support.
Nick Luizos, California Association of Health Plans, in support.
Nina Weiler Harwell on behalf of AARP California in support of SB 33.
David Ford on behalf of the Private Essential Access Community Hospitals in support of the bill.
Tim Kammer on behalf of LA Care Health Plan, representing over 1.7 million Medi-Cal members, we support.
Michelle Cabrera on behalf of SEIU California's 700,000 members, in support.
Kimberly Chen on behalf of the California Pan-Ethnic Health Network, also in support.
Do we have any other support? Any opposition? Questions, comments from committee members? Senator Hernandez, would you like to close? Or any comments?
Respectfully ask for an aye vote, and I have authors' amendments that the sergeants have distributed to add the legislative findings and declarations and the cap that interest charges as part of the voluntary lien. You have them in front of you as well.
Thank you. We have a motion from Senator Hall. Please call for the vote. The vote would be passed as amended to appropriations.
Hernandez?
Aye.
Hernandez, aye. Nguyen?
Aye.
Nguyen, aye. Hall? Hall, aye. Mitchell? Mitchell, aye. Monning? Monning, aye. Nielsen? Pan? Pan, aye. Roth? Roth, aye. Wolk? Wolk, aye.
Passes 8-0. Next item up is Senate Bill 125.
Thank you, Madam Chair.
Chairman.
Members, this bill reauthorizes the California Health Benefit Review Program known as CHBRP and updates the scope of work, and it revises an open enrollment period for individual market consistent with the new federal regulations. With that, members, I respectfully ask for an aye vote.
Do we have any witnesses in support of the bill?
Yeah, Madam Chair, Mr. Chair and members, Nick Luizos, California Association of Health Plans. We're in support of the bill. The bill does two key things, but important things. Number one, it aligns California's open enrollment dates with the federal guidance that has recently been issued. We think that's important. It results in less confusion for our plans and consumers, of course. And it extends the life of CHBRP, the California Health Benefits Review Program, which fortifies the legislature's analysis of bills that impact the cost of health care and analyze whether new proposed benefit mandates exceed the essential health benefits. So we think those are important. The program is funded by a fee on health plans, and we're happy to pay it for this very limited purpose and important purpose, so thank you.
Linda Way with Western Center on Law and Poverty. We're in support of changing the open enrollment period, as this would give health plans and consumers additional needed time.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Company. I just echo the comments, Mr. Luisos. We think that CHBRT brings a great deal of value to both the legislative process and helps with the dialogue. Additionally, we think that it's important to conform the open enrollment to the federal new guidelines. So for those reasons, we're in support.
Chair and members, Kathy Mossberg, representing the local health plans of California. We are in support as well.
Beth Capel on behalf of Health Access California. We're in support, if amended, of the CHBRT provisions. I well remember being here at in the small hours of the morning supporting the extension of CHBRT last year. However, this bill amends its purposes, and we would like the opportunity to work with the author to further refine and narrow the focus of the of that. We are supportive of CHBRT and its role in looking at benefit mandates and expanding that to essential health benefits, but we think the language could be further refined as we move through the process, and we have every faith that the author will do that. Thank you.
Thank you.
We also appreciate the amendment that he took to address social determinants of health, so thank you.
Mira Morton here on behalf of the California Chamber of Commerce, also in support of the reauthorization and the modifications to the CHBRT program. Thank you.
John Winger on behalf of Anthem Blue Cross, also in support.
Tim Kammer on behalf of LA Care. We support the open enrollment extension, giving consumers more choice, and the CHBRT extension. We think there's a valuable benefit to the legislator and plans. Thank you.
Any other supporters? Any oppositions? Members, comments, questions? Okay, there was moved by Senator Hall. Madam Clerk, sorry. I'm thinking of the, I'm sorry.
Just one comment to address Ms. Capel's question. There are amendments on page 9, line 27, which addresses one of her concerns, and I'm committed to continue to listen if we have any other additional comments we can make with her as well. And I respectfully ask for an aye vote.
Thank you. Pass as amended to appropriate. This will be passed as amended to appropriation. Please call roll.
Hernandez?
Aye.
Hernandez, aye. Nguyen?
Aye.
Nguyen, aye. Hall? Hall, aye. Mitchell? Mitchell, aye. Monning? Monning, aye. Nielsen? Nielsen, aye. Pan? Pan, aye. Roth? Wolk? Wolk, aye.
Oh, and it passes 8-0. How do you have 8 last time in? Oh, Roth is left. I'm sorry. Thank you.
We're going to lift them all.
I'm sorry. She closed these, though. So
Okay.
She can't do these.
Okay, we're going to go ahead and lift the calls. We're going to first start off with item number 1, SB 128, Wolk and Monning. If we can call the absent members.
Pan? Roth?
Aye.
Roth, aye. 6-2.
That current vote count is 6-2. That bill is out. Item number 3, SB 118, Liu. Call the absent members.
Nielsen?
Aye.
Nielsen, aye. Wolk? Aye. Wolk, aye. 9-0.
That bill is 9-0. That bill is out. We have the consent calendar. We already moved it, but we're going to call the absent members.
Nguyen? Hall?
Aye.
Hall, aye. Mitchell? Aye. Mitchell, aye. Roth? Aye. Roth, aye. So it's 8.
That vote count is 8-0. That the consent calendar is out. And item number 2 and number 4 were already closed, so we won't be lifting the call on those 2 bills. And with that, the business for the day is ended, and we are in adjournment.